Yay! Pa, you out of touch already lah. Should practice more. Pa? Pa, you okay?
I'm okay. Come, let's play one more time. This time I will win.
Enough already lah. You go and train more first. Pa, you wait for me. I go and get something.
What are you doing? Go away lah. You're blocking the TV.
Pa, smile. Say cheese. Pa, can you raise your arm? Both arms, please.
What do you want?
Just do it. I'll tell you later. Quick, raise your arms. Okay, good. Arms check. Now, can you read this for me?
FAST, fast. A quick test to detect stroke. It checks the face if one side of the face droops when asked to smile. It checks the arms if one arm drifts lower when asked to lift them. It checks the speech if the words are slurred or incorrect when asked to repeat a sentence. Time. If the patient shows any of the above symptoms, you must bring him to the emergency care immediately.
Pa, you have just read the paragraph on the FAST test. FAST is a quick test to detect stroke by checking the face, arms and speech. You just failed the face part. I suspect you may have stroke. We should send you to the hospital straight away.
Don't anyhow say. I may be a little overweight, but I hardly smoke or drink alcohol. How can I get stroke? Not possible. I don't even have diabetes, high cholesterol, or high blood pressure. Ma, don't listen to this nonsense.
But you have not had your body checked since years ago. How do you know you don't have all these things? Huh?
Pa, Ma, remember the stroke project I was doing for school? Well, do you know that stroke is the fourth most common cause of death in Singapore? Singaporean men who are above 40 years old, obese and smoke have a higher chance of getting it. Other factors like high blood pressure, high cholesterol, diabetes, irregular heartbeats, and excessive drinking of alcohol can also increase the probability of getting stroke. Stroke can strike anyone, and even young people like me can get stroke too.
Ah, are you sure anyone can get stroke?
Bluff one lah. How can that be possible? How can even those who are healthy get stroke?
Pa, that's where you're wrong. A lot of people may appear healthy, but they're not. In fact, many people don't even know they have high blood pressure, high cholesterol, or even diabetes until after they've gone for a checkup. And these are the conditions that can lead to stroke. So all these people who thought they were healthy can suddenly suffer a stroke. So you see, stroke can strike anyone, and the best measure to not get it is by prevention.
Prevention. Yes. Didn't they always say prevention is better than cure? Hey boy, tell me, what are the prevention tips? I want to check and see whether I am also at risk.
Of course, I was interviewing a doctor for my project and he especially emphasized on prevention. He said it's very important to go for checkups every year, especially for those who are 40 years old and above.
So basically, lead a healthy lifestyle, right?
Yeah, like don't drink too much alcohol and stop smoking. Luckily you don't smoke. Oh yeah, Ma, you're taking some medicines for your high blood pressure, right? You must not stop taking those medicines, as well as any other medications that you're on, unless your doctor tells you to. The doctor also says that if you have conditions like high blood pressure, high cholesterol, and diabetes, it's very important to seek treatment as early as possible and to manage them well to prevent stroke.
Oh, some of the diseases that you mentioned are very common problem for middle-aged people like us. Are these all we need to watch out for?
I think so, but if you suspect anyone of getting stroke, you can use the FAST test to check, like I did on Pa. Then, if you find any of the symptoms, Call the ambulance immediately so that they can be rushed to the hospital to receive treatment. The first 3 hours is the most critical period, and receiving treatment during this period can actually save our lives.
Oh, I see. The first 3 hours. What is that?
Pa! What happened?
Are you okay?
My arm. I can't move it.
Tim, call ambulance. Go, go, quick!
Doctor, what happened to my father? Is he going to be okay?
Mr. Sim has had a stroke. We've already done an MRI and a CT scan and found a blood clot in his brain.
Is he going to be okay?
We've given him TPA to help to dissolve the clot and restore the blood flow into the brain. It's a good thing that you brought him in early.
How's my husband now?
We'll be keeping him under monitor at the ICU. We will also be performing tests, and we might give him some aspirin and warfarin to prevent another stroke from happening.
What tests are you going to do? Is he going to be okay?
We've already done an MRI, a CT scan, and an ECG. Later, someone will come by to perform blood tests and an ultrasound.
Does he need any surgery?
Surgery will only be needed if there is severe narrowing of the neck arteries or if there's significant bleed into the brain because of the stroke itself. Based on Mr. Sim's CT scan and MRI, I don't think that he will need any surgery. Why don't you follow me to my office where I can explain to you more about his condition? Okay, so stroke is actually caused by a lack of blood supply to the brain, which may be due to a blockage or bursting of the brain blood vessels. If there is no blood in order to transport the nutrients and oxygen to the brain tissue, the affected part of the brain will become damaged.
So, how does stroke affect my father?
The effects of stroke vary between individuals depending on which part of the brain is damaged and the extent of the damage.
Why is my father affected only on one side of his body?
If the stroke affects the right brain, this will then affect the movement and sensation on the opposite side of the body, the left. If the stroke is in the left brain, this might then cause a loss of movement and sensation over the right side of the body, as well as affect the patient's ability to recognize people and objects. Other signs of stroke can also include difficulty in speaking and in understanding people, feeling giddy, losing their balance, or falling without any reason, a sudden loss or blurring of vision, having the experience of the worst headache in their lives, and having difficulties in swallowing. So in your father's case, he's most likely to be having a right brain stroke as he has problems moving the left side of his body.
So, when will my father recover?
The recovery period varies with individuals. However, you must know that the most important period is between 3 to 6 months from the time of the stroke itself. Recovery from stroke is a natural process and may continue for up to 2 years. Here is a handbook about stroke where you can find out more about the treatment and the recovery care.
Thank you very much, Doctor.
Hi, I'm bringing Mr. Sim for a scan now, so I'll be back in an hour's time.
Thank you.
Bye, see you later.
Ma, look here. See? This book tells us a lot about stroke, in even more details than what I've learned in school. There are 2 types of stroke, mainly ischemic stroke and hemorrhagic stroke. Ischemic stroke is when an artery is blocked either by fatty deposits or materials from other parts of the body. Hemorrhagic stroke is caused when an artery bursts due to blood clots or weak vessel walls and the blood bleeds into the space around the brain. Sometimes, patients are unable to tell if they have stroke because the symptoms are usually temporary and disappears completely within 1 day. This is called transient ischemic attack, or TIA. TIA occurs because the lack of blood supply is only temporary or the damage is very small. Having experienced TIA is a sign that a stroke may occur in the near future.
Boya, does this handbook say if there's anything we can do to help your Pa?
Well, it says here that Pa will have to adjust his diet. He needs to take less fats and salt and eat more high fiber food. He will need to start exercising regularly too. And stroke patients should stop smoking and reduce alcohol intake.
Oh. From now on, I'll cook with less salt and less oil.
And I can help Pa exercise and bring him brisk walking too.
Good.
Hi, morning.
Good morning.
Hello.
Mr. Sim, how are you feeling today?
Okay.
Okay, good. The physiotherapist will be coming later in the afternoon to help Mr. Sim for some rehabilitation.
Oh, why does he need to go to rehabilitation?
Well, rehab is actually very important for stroke recovery. Okay, so it can help patients to actually regain their independence level as much as possible. So, for example, physiotherapy can help patients to actually relearn their muscle movement. For this speech therapy, they can help patients if they have this speech or eating problems. Okay, so occupational therapy, the therapist will actually come in to assess Mr. Sim to see whether his living or working environment is suitable for him to move around. Okay.
So after my father comes home with us, where can we get help?
Okay, I can actually refer you to the help and services you require now. Okay, but if let's say after your father discharges and you realize that he needs further assistance, you can actually approach the case manager from the outpatient clinic for the referrals to those services. So in fact, there are many resources that you can seek help from, such as hospitals, polyclinics, your family physicians, and rehab centers. So all this information actually you can get from the stroke book you have received. Okay, come. I'll have to do some simple check for Mr. Sim.
Okay, thank you.
My dad has stroke and I can help because I know how. Number 1, do the FAST fast test to check for signs of stroke. Number 2, if you notice any symptoms of stroke, call the ambulance immediately. It is critical to get help within the first 3 hours. Number 3, if you are 40 years old and above, are obese and smoke, you have a greater risk of getting stroke. Number 4, prevention is the best measure. Take good care of your health and adopt a healthy lifestyle. It is necessary to go for regular medical checkups to detect and treat any conditions that may lead to stroke, such as high blood pressure, high cholesterol, and heart diseases. If you already have these conditions, manage them well to prevent stroke.